Feverfew, Tanacetum parthenium, is a flowering plant in the daisy family Astraceae. Known for its potent medicinal properties, it has been used for centuries in traditional medicine to treat a variety of ailments. Native to parts of Europe and Asia, Feverfew is now cultivated in many regions worldwide. Its name reflects its historical use in reducing fevers, though its applications extend well beyond this. Habitat: Feverfew thrives in a variety of habitats, including meadows, roadsides, and garden borders. It prefers well-drained, slightly alkaline soils and can often be found in sunny or partially shaded areas. This hardy plant can withstand drought conditions and is commonly seen in temperate regions. Growth: Feverfew is a hardy herbaceous perennial, although it is sometimes grown as an annual in colder climates. It typically reaches a height of 30 to 60 centimeters, 12 to 24 inches, and forms bushy clumps. The plant's resilience makes it a popular choice for gardens, where it can self-seed and spread easily. Type: annual perennial. Feverfew is primarily a perennial, meaning it can live for more than 2 years. In some regions with harsh winters, it may be grown as an annual and replanted each year. Identification: Feverfew is characterized by its bright green, pinnately divided leaves and small, daisy-like flowers. The flowers have yellow disc florets surrounded by white ray florets. The leaves are aromatic with a distinctive, slightly bitter smell when crushed. The plant's overall appearance is similar to that of chamomile, though Feverfew's leaves are more deeply cut. Edible parts and uses: While not commonly consumed as a food, Feverfew leaves and flowers can be used in small amounts in salads or as a garnish. However, due to their bitter taste, they are more often used for their medicinal properties rather than culinary purposes. Parts used medicinally: The primary parts of the Feverfew plant used medicinally are the leaves, although the flowers and stems also contain beneficial compounds. The active constituents in Feverfew include parthenolide, flavonoids, and volatile oils, which contribute to its therapeutic effects. Medicinal uses: Please note, this video is for educational purposes only. It is not intended to diagnose, treat, or cure any ailment or disease. I recommend consulting with a healthcare professional that is knowledgeable about complementary medicine prior to trying anything new. Feverfew is renowned for its diverse medicinal applications. Migraine: Feverfew is widely used to prevent and alleviate migraine headaches. Regular consumption of Feverfew leaves has been shown to reduce the frequency and severity of migraines. Tension headache: The anti-inflammatory properties of Feverfew help in easing tension headaches. Fevers: Historically used to reduce fevers, hence the name Feverfew. Cold and flu: Feverfew's anti-inflammatory and analgesic properties make it useful in managing symptoms of cold and flu. Colic: It has been used to relieve colic pain, especially in infants. Menstrual cramps: Feverfew can help alleviate menstrual cramps due to its muscle-relaxing properties. Regulation of menses: The herb is also known to help in regulating menstrual cycles. How to harvest and when: Feverfew should be harvested when the plant is in full bloom. Typically in late spring or early summer, the leaves and flowers can be picked and used fresh or dried for later use. Warnings: While Feverfew is generally safe for most people, it can cause allergic reactions in some individuals. Those who are allergic to ragweed, marigold, or chrysanthemum may also react to Feverfew. Common allergic reactions include dermatitis and mouth sores, particularly from chewing the leaves. Additionally, Feverfew should not be used during pregnancy or by individuals with blood coagulation issues, as it can increase the risk of bleeding. Feverfew is a valuable herb with a long history of medicinal use. By understanding its properties and proper usage, one can safely harness the benefits of this remarkable plant.